City Fertility is providing a lot of hope and support to the couples who have been so far not been able to conceive or have their dream family. It is as we know now, 1 in 7 couples around in the UK have got problems conceiving, and having a clinic that can support and help and through this journey for them to fulfill their dreams is very important, and City Fertility plays a very important role in that. City Fertility at the moment, development happening all around in the world of reproductive medicine. As we know, there are newer technologies that are happening, and City Fertility, I must say proudly, is able to accommodate and continue with the most latest technologies, whether it is time-lapse in the lab or doing the latest techniques of embryo testing. Everything is available at City Fertility. We also having collaboration all around in Europe and having more clinics working together, which then gives the City Fertility an edge of having a very valuable in-house data collection and to come to strategize or harmonize the way of practicing, which gives our patients the best outcome and the best results. I think for me, every patient who has been successful at City Fertility is my highlight. Every patient who has started their journey and ended up with the baby is very important and very rewarding for me. I cannot obviously disclose any names or identifications here, but there has been a patient I've had, because the journey had been so long for that patient, you know, as I say, we'll live the journey with the patient. We go through all the emotion. As much as they want the cycle to be successful, we equally want the cycle to be successful. And having that up and down together makes it so special. And there could be patients who've done probably more than the other patients, which has been unfortunate for them. But having a patient through a successful cycle after having 8 failed cycles was something that was very close to my heart. And then when that patient came back with the baby, I thought, you know, this is the best day in my life. I've chosen the right thing. I'm doing the right thing. And I just felt so grateful to, I think, I don't know, starting from the God to the technology to everything, and to the patients and perseverance of that patient to believe and trust in me so that we could come to that end result. So I think that patient is very close to my heart. Again, I can't disclose any names here, but difficult journey, but in the end, a successful journey. So the specialists that we choose here are, of course, based on their, you know, their medical degrees. Of course, that's the first thing that we check. Their registration with the GMC, and mainly their experience, their work experience. Now, these comes as broadly as something that you would look at a CV and say, fine, you've done this degree and that degree and that degree, which I think lots of us doctors have to do, and we've done it. I think the most important criteria also that I look for when I'm recruiting anyone here is we want a team player. We want somebody who has the compassion and the empathy for the patient, who is sensitive and who can understand the sensitivity of the field that we are in. We are in a very, very gentle and emotional field of medicine. And that is one of the very important criteria that we here at City Fertility put a lot of emphasis on.